into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, with my Houston surgeons. And I have a special guest who has been on before, but now she was so good, we're doing another one. So welcome back, Dr. Reddy.
Great to be back. It feels like just yesterday. Thanks for having me on again. I appreciate it.
We had so much fun talking, and Dr. Reddy is actually in a unique position because she's not new to practice, but she just within the last year opened her own private practice. So I thought this would be a really great story, not only for patients who listen, right, but for the plastic surgeons who listen, because maybe they're in the same place you were before. So why don't you tell us a little bit about your story? Like after you graduated, where did you go?
Yeah, so, I graduated from residency in 2021. It was a wonderful time in healthcare. We were in the peak of the pandemic.
Mm-hmm.
It was not a great time to be straight out of training looking for an aesthetic job. And so I'm sure there's a lot of different surgeons who are kind of in that same position. So you really at that point kind of had to go wherever there was demand or a good job. And I had a recruiter reach out to me with what sounded like a great job opportunity. It was in Richmond, Virginia. I had never been to Richmond, Virginia. I had zero family in that area, which to me was a slight perk at the time. So I came out to Richmond, did an interview. Everything looked, pretty great on the surface. And so I had my husband, who's a physician, quit his job. We moved him and I think at the time, 1-year-old to Richmond and started practice. And I think as plastic surgeons, we know so much about a certain field, and then we know so little outside of that. Mm-hmm. For people who don't know our training, like I went to med school when I was 21 and went to plastic surgery residency at 25 and then emerged from residency at 31. So from 21 to 31, I was like hidden in the library or a hospital, and we don't truly participate in the real world. Like as a 31-year-old, I was like, I have no idea how to pay my taxes. Just real world responsibilities. I feel like sometimes residents, doctors, we just are kind of oblivious to. And then the other thing that we're not great at is trying to be able to assess, the business side of practice. And I think that in healthcare in general, it's a shame, but you see doctors, we trust the system. We're employed by hospitals and private practices, and it's a tale as old as time. But, I think doctors end up coming up short because we're so poorly educated on the business side of things.
Yeah.
And a lot of that learning is just through life experiences. I know with your family, you come from, I think, a family of ophthalmologists mainly.
Yeah.
They're eye guys. So I think that helps coming from a family, at least that has experience in the private practice realm. Like my mom was newly divorced and opened 5 of her own family practices when I was a young kid.
Wow.
So
yeah.
I did get to know a lot of the business side just by watching her do that. Mm-hmm. And I credit her a lot for teaching me that side of it. So long story short, I took this job, but unfortunately, as you find, there's not a great way to vet who you're going to work for, and the best advice I can give to surgeons who are listening, who are trying to find a good job is call previous associates and take the time to vet them and try to see if they have signed an NDA, because if they have, they're not going to say much. But if they haven't signed an NDA, those are the people who are really going to be able to tell you the pros and cons of taking that job. But some of the red flags, if you're associate number 4, 5, 6, that's kind of a
In
straight.
5 years. Yeah,
Yes.
exactly. Yeah. Yeah.
Like, some red flags should pop up. Like I was associate number 4 and I was like, maybe the first 3 were just crazy and I'm going to be better. You kind of also you intentionally are a little naive because you just want it to work. But unfortunately, I think the statistics are pretty slanted that first job you're going to take as a plastic surgery junior attending, the job's usually not going to work. And that's okay, but just learn as much as you can. In retrospect, I wish I had done more of that research and talked to more. I didn't have a good hookup with the Richmond community to get those understandings. The other really great source of information is actually our implant reps, or the reps that work in our industry.
Yes. Yeah.
And again, as a resident, I was very naive to that, but now in retrospect, chatting with your local reps or having them connect you with a regional rep, that's a great access to some good information and knowledge.
Oh yeah, they know all the tea. So,
Always.
yes.
Yeah, so if you want the tea, you go to the reps and they will hook you up. And I think that's great. But I think unfortunately in our field, especially, it's so hard because there's a huge personality problem in plastic surgery where some plastic surgeons, they just need to be the best. They need to, as long as you're not outshining them, we're good. But if you start approaching that territory, or you start appearing as competitive, even if you're not, it's hard to work cohesively together. And especially when, the economy's in a bad place, or, consults are slimmer to come by, that's, I think, when things can start potentially turning a little bit more nasty. I know you work in like a pretty big group. You guys have like a unique setup. I'm not 100%.
So I would say, so I started off, I'm in the same job that I've been in for 10 years now, but like,
That's amazing.
I started off as an associate. I wasn't the first one. But like, people had stayed, some people had left, but when I joined, it was very similar. I wanted to be in Houston. That was where my brother was. I'm really close to him. And I wasn't married at the time. So I was just like, okay, I'm going to go someplace so I don't have to scrape my car because I don't like it cold. And so that's how Houston happened. And okay, great. I got this great job, and some people knew this guy. I'd heard some things that were, whatever. If he's listening, he knows. But overall, I was like, okay, I'm just going to take this job. And I was an associate for 4 years, and then I partnered after 4. And so it's been good, and I have grown, but there were challenges. There were things I didn't realize. But thankfully, I ended up joining somebody who was willing to see those things, talk about them, and like, we're like family now, right? Like, so I mean, we've had fights, we've been like, we've had disagreements, we've had to work it out, but like, I totally trust this person. But so our setup, like now we have 4 partners and everybody else is associates. So I mean, but it wasn't easy, even though I think I was in a pretty decent situation. There were times where I was like, especially as an associate, where I felt powerless. I'm like, I don't like this, but this is my job. I worked here. And especially after a couple years, it's like, okay, built up something here. I don't want to just walk away from it.
Yeah.
But like I said, a lot of it has been because the person who started our group, he obviously felt territorial. It was his group. But he's grown and been open to changing and supported people. So that's why it's worked for us, is because even though I know all of us, we all have egos, we're surgeons, like, all of us want to shine, but like truly he will come up to me some days and be like, I'm so proud of you. I love seeing how you succeeded. And it's because he told me something my first year with him, because we worked in a building that had a ton of plastic surgeons, a huge hospital building. And I was like, aren't you worried about the fact there's so many plastic surgeons here? And he's like, you don't have to worry about other people. You worry about yourself. He's like, if you're doing the best you can do, then you'll attract people. Like, and it was really like, it really meant something to me. He's like, I'm not threatened by anybody else because I'm doing the best I can do. And that's all you have to worry about. So I just feel like that's the kind of people you need to line up with if you're going to do a group. Otherwise, you're going to end up trouble.
Yeah, I couldn't agree more. Like, just that mentality of understanding, if you truly bring the best, you don't have to worry about anybody around you. Unfortunately, there's so many fragile egos in our specialty who can't handle that. But if they are comfortable in themselves, in their work, they won't be threatened. And a lot of people, I think, will be happy to mentor and teach, and that is very rewarding. Like, I'm sure your partner, has a lot of self satisfaction knowing how successful and how much you've grown, and that you guys can work together as a family. I feel like as a surgeon, I would love to have that one day with a junior colleague.
Yeah.
But it is like a family. There are going to be fights and disagreements, but
Mm-hmm.
ultimately, you want to feel supported. And if you feel like you're being sabotaged internally at the place you're supposed to work at, that can be so hard.
And it's hard enough that you're building your practice, right? Like, I mean, you're
Yes.
focused on that. So it's like if you're having to go against the current, it makes it extra hard.
Yeah, I mean, like the first year in practice are so stressful. And then when you start to wonder, like, you don't have time to be like, is the call coming from inside the house? Like, is somebody like taking God's thoughts from me? Like, what's happening?
Yeah.
But, I think that was happening, in some respects. Like, the receptionist was being told, like, don't tell them there's a female surgeon at this practice if they ask. Like,
Dude, why hire a female
okay.
surgeon? Like, I just, yeah.
Right. So it's painful. And I think junior plastic surgery colleagues who are looking for a job, it's definitely not easy, but, lean on, I think Instagram has helped us all connect so much better. And, I think it's a lot easier to understand and get help from the community and know what's going to be a good market and what's not. But I also think that the market and the location is very important too. Like, Richmond was a random place for me, but it's been such a wonderful place for me to grow my practice. And I'm so grateful for it too. It was just the right time at the right place for me to open my practice. But ended up, I spent 2.5 years in practice at that place. And it got to be so toxic. And if you've ever worked in a toxic workplace, you know how draining that can be. And I've always enjoyed what I've done. Like, surgery's never felt like work to me. And I think a lot of us feel that way. That's how we endure the crazy residencies, because we enjoy it so much. And so if a workplace becomes toxic, it can really soul suck everything out of you.
And as plastic surgeons, during those first years, we're not just like building our practice. We also have to be thinking about our board certification. So we're
Yeah.
collecting cases. We do take a written test, but we have to take an oral test and we have to collect our actual cases. And it is stressful. So if you're trying to build this practice, get your boards done, do all this stuff, like, I mean, you've got no energy left for yourself.
Yeah, no, absolutely. And so I just remember it was a random Tuesday in January, and things had just escalated so much that I called and was like, I'm out. I'm resigning. We had literally just moved into our brand new house that we built like 30 days prior. And my husband was like, you quit your job today? And it was like, I remember being like, what did I just do? But it was ended up being one of the greatest decisions I've ever made. And the thought of starting your own practice can be incredibly daunting. There's so many things that we don't know. Like, how do you make an LLC? Like, where is the practice going to be? Like, what malpractice insurance do I need? How am I going to do advertising? How am I going to hire people? But it is actually a lot more doable. And I think it's like a gatekeeping thing where people like, don't make your own practice so hard, so crazy. You'll never make it work. But it's actually very, very doable. And the ability to be free and be yourself and know that every day when you walk into work, like, you're walking into a supportive team that you built, that everyone's there to help each other. That to me is priceless.
So, how was your transition? Like, when you delivered this news, like, how was that met out of curiosity?
Um, Incredibly chaotic.
You're like, I can't repeat those words.
My lawyer is going to call me in like 3 minutes and be like, we told you not to talk about this. Like, at first, the first 48 hours, like, okay, well, let's keep this very kosher. Let's be very collegial about it. And then that quickly devolved. Things just got very contentious, very uncomfortable. I was getting emails like, you're not allowed to show up on the property from this time to this time. Your office is being relocated to somebody else's office. I'll see some of your patients for you. And that's kind of when I drew the line. It was like, no, like, if they're my patients, I need to see them. I guaranteed them that I would carry them through their postoperative recoveries. I'm going to do that from start to finish. And I just remember, like there was, some struggles about PTO and when the final day was, and I was like, I'll just cruise out and use my PTO as my last few days and then be done. And day one of my PTO, we were supposed to go to Mexico. And so we were in the airport and I look at my email and it's like, oh, you've been terminated with cause. I'm like, but I resigned.
You're
And
like, you can't fire me after I resigned.
literally, I was like, but I quit. And I remember my husband was like, get your bag. Like, we got to go. We have like 2 little kids. My daughter, I think, was like 9 months old or something. And we're getting on the plane. I'm literally like, oh, yeah, I just got fired. And I spent that entire week in Mexico, like literally poolside with pods in at my laptop, just Zooming with lawyers. It was like the trip from hell for me. My husband was like, oh, remember we went to Mexico? We had such a great time. I was like, it's
You're like,
literally.
did you have a good time?
It was the
Because I'm
most
pretty sure
traumatic
I
time.
broke up with somebody and then they tried to break up with me.
Yes, literally, that's what it felt like. And that was probably like the darkest, like deepest part of my life. But since then, it's only been upwards and onwards. And I quit my job end of January. I
Uh-huh.
had a lease space renovated within 4 weeks. Miraculously, a contractor
Wow. That is a pretty impressive
delivered.
turnover. Yeah.
Yes. So got really lucky, and we were able to open the practice April 1st. And I remember the
April
first,
1st.
yeah, April Fool's Day.
You
I was
picked
like,
a great day.
my mom was like, "This is not auspicious. This is a terrible
Yeah.
idea." But it all worked out. I remember that April 1, Verizon was like, "The Wi-Fi's not working in your practice," and I was like, "Amazing! It's literally opening day." So we had the phones running from my house. Like my receptionist was like in my living room with my dog and my children. But it all worked. And it's just I've been so grateful that, the Richmond community has been so supportive, and there's no price you can put on your freedom, and just being able to be yourself and exist is priceless to me for sure.
100%. 100%. And like, because you're happier and healthier, you can take even better care of your patients.
Yeah. Yes. And like, I think me and you like are pretty open on our social media, and I can, post whatever I have. I still have a little bit of trauma. Like when I post a story that's a little bit out there and I'm like, is someone going to call me from HR? And I'm like, no, no
Yeah.
one's going to call me. Like I am the HR.
You are
Finally.
HR.
Yes. Yes.
But I mean, so there are positives and negatives to everything, right? Like when I went from an associate to a partner, so became an owner, I learned the cost of vacation, right? Like it's like, when you work for someone, you get your PTO days, you go, you're fine. I still thought about my patients. I still, but I could go. But like when you own the place, if you're not working, you still got bills to pay, you still got people to take care of. So all of a sudden vacation was like, okay, I need to be careful. I can't, and like you said, you didn't take vacation in 2 years because you're like, if I'm not working, I'm not bringing in money, and I have responsibilities as a business owner now.
Yeah. I think I'm still in like the early stages of that. I'm very much in the like, I'm going to throw myself headfirst into this, and just be a full blown workaholic, which I'm sure at some point is not going to go over well. And I think my husband's been so incredibly supportive, and he definitely helps me. I think your husband does a great job of
He
being
does
super
a lot
supportive.
to help. Yes,
Yes,
he does a
yeah.
lot to help.
Yeah. And I think that is helpful. And I have to learn those lessons that, you have to take care of yourself. You have to bring some balance to it. But when it's your own name on the practice, it's just like there are no off days. I can't divert any of these responsibilities to someone else. At the end of the day, I have to be on 24/7. And at some point, I think I will like do a better job balancing that. But like, what in our life teaches us to do that well?
Yeah. I mean, even from our training on, like, there's no There's no, now they're trying to put more emphasis, which I'm really excited about that. But our programs, there wasn't balance. You belonged to your program.
Mhm.
And, like I can even remember being off, I wasn't on call that day. And the chairman called and was like, I'm taking this case is going, I need you. And I was like, oh, sir, I'm not on call today. And he just like, it was just like this pause. And he's like, so I'll see you in 15
You're like,
minutes. And I'm
I'll be
like,
right there.
I'm at a dinner, like, and I'm like, yes, sir, I'll be there in 15 minutes. Like that's how we are trained. Like
Yeah.
you're there and there isn't balance at all. So it is really hard to then get thrown into then be like, well, now how do I balance?
Yeah, it's very interesting to see generation where Gen Z come up through or see them when they come through surgical residency. I think we were raised by boomers-ish. And so like the idea of like just like work is your whole ethos was something that, in my family that was very normal. And that understanding really helped me get through surgical residency. That was very normal for me to just commit my entire life to residency. And I didn't really think of any kind of alternative way to live. But like you said, the culture is shifting a lot. So I think maybe in the future they'll be better at it. But at a certain point, I think like Dr. Wall, I've seen her say really famously, you have to really, really think about going into surgery because there will be big days where like your kid's graduating, but if a patient's having a surgical emergency, you got to just go. And
Yeah.
there is an insane amount of sacrifice that the job demands.
Yeah.
Um,
Yeah. And the thing is, though, is we love it. That's why we do this. Like you said, like I can be in the OR all day long and it's like, it's a blast, so it's time passes differently there.
yes.
And so, and I guess, I mean, that's why we get attracted to it because that's just the kind of, we're wired that way. So I'm not sure that we will ever completely have balance in our lives, but
Yeah.
that's often why we are attracted to spouses who they know that about us, right? Like I
Yes.
joked, I was like, maybe I could just retire to this place. He's like, if you're not doing work, you're going to be miserable. So he's like, you can't retire. He's like, we'll have to just figure out something slower for you.
Yes. Like I have literally attended my mom's fourth retirement party. And I'm like
She's
she
doing a
just
poor
won't.
job at retiring.
Yes, and then she'll like get off the phone and be like, "Sorry, I'm in the middle of clinic." I'm like, "You literally retired for the fourth time. Like, why are you still in a clinic?" But I might end up being that same exact way.
Yeah. Well, I mean, it's just we're passionate about what we do. And so now it's been a year in your practice. So, like, is there anything you wish you had done differently? I mean, we talked about kind of like, with your first, is there anything you wish, like, with starting a new practice, you didn't get as much time, right, to set it up? Is there anything you wish you'd done differently at all?
I probably need to take some time to look and um, just, oops, I'm going to restart that.
Okay, you're fine.
um, in retrospect, it's hard to say. I think there's so many curveballs that come at you that first year. The biggest things I would say is just to outsource the things that you don't have time for. You have to be able to give tasks to other people and have a great team that you can 100% rely on to take care of it without you double checking on that. Building like a very, very strong team. And I think when you first open a practice, you're like, okay, I want to keep my overhead down. I don't want to overhire too many people. But you do need to hire people. You cannot do everything by yourself. So you can't be running the social media. You can't be answering the phones. You can't be paying all the bills and scheduling the surgeries and operating and seeing patients. So you
Yeah.
have to be comfortable delineating and delegating. And a lot of us aren't comfortable delegating because we're type A, we're neurotic. We want to make sure it gets done. We want to make sure it gets done well. But, I remember the things that were important to me are keeping the overhead low in terms of don't buy a bunch of big fancy machines your first year. All the reps are going to line up in your lab and be like, hey. But like run away. You can eat the lunch with them. But, I would not invest in any kind of huge 6-figure machine that promises to do it all very early. And I think that is a very solid idea. And embrace social media wholeheartedly. Like, I feel like in terms of marketing, I pay almost no money to marketing. All of the patient leads come through Instagram or Google reviews, and that is huge. And I'm very grateful for that.
It also speaks volume to how well you take care of your patients, that's how you're getting a majority of your patients that way.
Yes, and I am grateful for them for taking the time, because a lot of, I think writing a Google review when you've had plastic surgery, that's asking a lot of a patient, right? Because they have to put their
Mhm.
name on it. You
They
can't
got
just
to out
anonymous.
themselves, yeah, sometimes,
Yeah.
yeah.
So, I really appreciate my patients. They really take time to write heartfelt Google reviews, and you can't fake that stuff. Google's pretty strict about it. They'll catch it if you're faking it. So I do think they authentically do a good job of that. In the past, we had stuff like Real Self, and it seems so phony. I feel like people were paying to play. And I feel like that's largely fallen out of favor. If I'm not allowed to say that,
You're allowed to say whatever you need to say. I mean, Real Self has changed a lot. Like, I think it still has some relevance. I think that, like, I mean, I've got questions I answered way back when, but it is different now. It is structured differently, and I doubt anyone from Real Self would argue with us on that, you know? But I
Okay.
agree with you with the whole, like, you don't want to have too many people when you start out, but at the same time, it's really changed. Like, I read a book that said, it's not how, it's who. Sometimes you really have to get that help. And I did that early on. Is like, I initially seemed like I had this team that was like bigger than people. And they're like, oh, well, you have so many people. And then later people are like, how do things run so well? And I'm like, because I built this team that like helps me. And I still do a ton of stuff myself. But I just realized I couldn't get to that next level if I didn't have people who could help me with things.
Yeah. And like, I think in the older generation, we always saw, like, if there was a plastic surgeon opening practice, his wife would assume like the office managerial role. But you've seen a huge turn away from that. And I think that, like, I would never put my husband on my payroll. That would like instant divorce. That would never be a great idea for us. But hiring people, your team is so, so critical. And so each of them has to be great and not married to you.
And they're and they're a reflection of you, right? Like
Yeah.
anybody who my team is taking care of, I want people who take care of like I would, right? So it is a critical part of building a new practice.
Yes. Yeah. And like, those people are going to interface so much with the patient. So they have to be kind, they have to have your same vibe. If they're not going to be courteous and make patients feel comfortable, eventually that's going to come back on your
Yeah.
brand in a bad way.
Well, I want to end on a fun note. So we talked about like, the challenges, things. What are you excited about in your practice? So what's like the future of Ready Plastic Surgery?
That's a great question. So one of the things that I love doing, like if I wasn't going to be a plastic surgeon, I would love to be like a comedy writer for a TV show. And so one of the things that we do that we did like early on in the practice was we kind of did like a spin-off of The Office, and we would do these mini episodes and
Yeah.
release them on Instagram. And it was
I
so
think
much
I've seen some
fun.
of those. I've seen some of those. I was like,
It honestly brought me so much joy. Like, it may not have anything to do with plastic surgery, but it was great for team building, and the patients got to see us interact in genuine, fun ways. And we would love to bring a bigger and better season 2 this year. So I got to hit the books and do some script writing, but we would love to do that. At some point, I would love to do a Netflix, like, behind the scenes, all the tea drama show. I'm just waiting for them.
you're like, call me.
Yes,
It's
please.
like,
Netflix, this is your chance.
I'm interested as well. So that would be too fun.
Like, the Netflix plastic surgery shows, I'm like, guys, this isn't even like, you're not even brushing the surface of the drama. There is so much drama and gossip, and like, there could be so much.
Okay, so Netflix, if you're listening, we're open to discussing our roles. So,
Yes, we will bring all of the gossip and drama.
well, thank you again for agreeing to chat with us again, because this is really helpful. And I really do think that there are people who are out there that may have heard this and like be like, okay, I can do this. And for
Yes.
patients, understanding we're people, we're trying to do it all sometimes, but we really want, if you want your surgeon to be in a happy environment where they're thriving, because then they're really going to knock it out of the park for you.
Yes, absolutely. And I definitely think for the surgeons out there who are listening, it is totally attainable. If I have two small pieces of advice: one, don't sign the NDA. It's never worth it. And two, don't sign the non-compete.
Yeah. Yeah.
I think
We're
non-competes are going to go away,
Yeah. Hopefully.
hopefully.
Well, thank you so much. One more time, tell our listeners where they can find you.
Yeah, so if you ever want to reach me, my Instagram handle is KReddyPlastics. That's the best way to reach me. We also have a website for our practice, ReddyPlasticSurgeryGroup.com. It's been so great chatting with you. You're a great host, and I love to talk to you in the future.
All right. Well, thank you so much for joining us. Get some rest. And thank you all for joining us on the Confidence Doc podcast.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.